Conversations from the sidelines of HTLS 2025 continue. My next guest is Ayush Chauhan, Director of Prakash Hospital. Mr. Chauhan, thank you so much for taking out the time and talking to us.
Thank you, Abhishek. Really excited to be here at the Hindustan Times Leadership Summit 2025. It's great to be here.
Yeah. Have you managed to attend any of the sessions?
Yeah, I have attended 2-3 sessions and will be attending all the sessions from now on till Modi ji's final.
I think it's 4-ish right now. So in a couple of hours.
Yeah. I'll be attending the whole sessions. Yeah, all the sessions.
Right. So far, what's the experience been like?
It's fantastic. We have leaders from all the fronts. We have from politics, economics, sports, and everyone from the justice to everyone. It's basically a perfect platform to have to listen to world leaders basically, and to have an insight on global things on various topics. So it was really good to hear Adanya CM Yogi Adityanath ji, Foreign Minister Jaishankar ji, Finance Minister Nirmala Sitharaman ji, and then we have we have Indian female cricket coach Mazumdar ji. So it is always nice to listen to the leaders and the world leaders. And I think I have been following this summit since I was in school. I remember when I was in school, I think presidents from different countries used to come over here. So it's a legacy. So that's
right. Yeah. And if you can, while we are doing this, just look at me. Cameras are flies on the wall.
Yeah.
It's a conversation between you and I. So moving on quickly. So you have managed to attend some sessions. We have spoken about your experience. Now, you're somebody who runs a couple of hospitals, a medical college. Healthcare is not an easy sector to operate in, right? And close to Delhi, I don't know whether that makes things easier for you or more difficult. So if you could talk to us about the sector and what it is like to sort of, run a hospital, and what is your ambition? What is your goal as far as, what you're doing is concerned?
So healthcare in India, as we are a developing country, has evolved a lot in past 2-3 decades, and it's growing like anything since a decade. And in past few years, you can see tremendous foreign funds infusing into Indian hospitals and taking over the healthcare sectors. A lot of funds coming up. It's shaping up towards basically a more structured way. Right, and but there's one concern which is going on, because as we have majority of middle class people and lower middle class people, and the cost is also increasing a lot. Affordability is a question. So what my personal goal is to provide the healthcare at an affordable cost with a good quality care, right? And that will be a challenge in the future, because we have world-class hospitals right now, but the challenge is the affordability is not there. So the rising cost may cater to top 5-7% of the Indian population, but what about the others? So we need to have some affordability thing also in the hospitals, and that's what we are trying to do.
Is there a solution there? I mean, is there something that can be done to ensure that healthcare is available to all?
So, Adanya Modi ji has already done this Ayushman scheme. So, honestly, if we talk about the rural and semi-urban areas, already this Ayushman scheme is a super hit. And we have small hospitals, we have decent-sized hospitals, all are taking Ayushman patients. So, the poor people are getting the healthcare, which was not available to them. But right now, they have an access. If you want to do a heart surgery, so hospitals are doing it. If you want to have a knee surgery, they are doing it. It's always in automobile, we have Porsche, we have Audi, Mercedes, and we have Maruti and Hyundai also. So it always be like we will be having a top-notch care, top-notch hospitals with a decent price, with a high pricing, and we will be having hospitals which will coexist with them with affordability, right? So but definitely in India, our healthcare, if we talk about the cost as compared to the world, it's already very cheap. We, as compared to US, Western countries, our top-notch hospitals are also 20% of what they are charging. and with almost the same care. So, and the incentives which government is giving, and with the reduced GST in the insurances, there's a lot to do in the healthcare system. There's a lot to do, and I think it will boom like anything in next 10 years. It's the time for the healthcare in India.
Right. Okay, and that is great to hear, because at the end of the day, we are talking about a country of 1.4 billion people with a relatively not so well-off population.
Yeah,
at least at the bottom of the pyramid.
Yeah, that's the point. Yes.
So affordability is very important. Now, I want to circle back to what we're all here for, and that is, of course, the Leadership Summit. What would you say is your leadership style? How would you describe yourself as a leader?
So it's to be focused and just do the hard work and be focused. I think rest will follow.
Right.
Yeah. I've seen the leaders, everything. So there's no, basically, you have to do the hard work and you have to remain focused. And I think after a certain period of time, you will achieve your goals. Make goals, be focused, and do the hard work. So that's the thing.
All right.
Yeah.
On that note, that's a good note to wrap this up on.
Yeah.
Thank you so much, Ayush, for taking out the time
Thank you.
and doing this. Thank you.
Thank you.